Good evening. I'm Susan D'Antoni, CEO of Montgomery County Medical Society, and on behalf of MCMS and MedChi, the Maryland State Medical Society, I welcome you to this important webinar entitled Passionate About Private Practice. Tonight is our fifth in our webinar series designed to support and assist early career physicians. However, we understand this topic is of interest to physicians throughout your careers, as we recognize that you are always looking for alternative practice options that provide a better quality of life and more control over your patient care and operations. Before I introduce our speakers, I want to remind you of a few upcoming events and activities. On April 27th, just next Thursday, we invite MCMS members to attend our annual meeting and installation of officers. It's at the Pooks Hill Marriott in Bethesda. We will be installing our new president, Angela Marshall, recognizing our 40-year physicians. We will have a legislative update with Gene Ransom with MedChi, and be hearing from our new county health officer, Keisha Davis. On May 23rd, at 7 p.m. via Zoom also, we will host a program entitled Your Financial Future, a three-pronged strategy to being financially successful. We encourage you to register for this program. We also encourage you to register for MedChi's Physician Empowerment Program on RPM, e-prescribing, and more, and also an open discussion on May 25th to learn more about your pain points. Now on to our program. It's my pleasure to introduce Dr. Brent Faulkner and Joanne Faulkner. Dr. Faulkner is a plastic surgeon and owner of Faulkner Plastic Surgery and a past president of Montgomery County Medical Society. Dr. Brent Faulkner, along with his right-hand operative, Joanne, will discuss his career journey, which led him to opening his own private practice of plastic surgery and the many lessons learned and rewards of being his own boss. He will discuss how he made the decision to enter private practice, the practice startup process, and the greatest challenges and best practices he's learned along the way. Just a reminder, this program is being recorded, so we ask that you continue to mute your microphones. Dr. Faulkner will speak for approximately 45 minutes and then respond to questions afterwards, which can be submitted via chat. This presentation will be posted on MCMS and MedChi's YouTube channel soon for future reference. We ask that you now turn your attention to our presenters as they share their passion for private practice. Dr. Faulkner?
Again, thank you, Susan, for the introduction. Thank you all for attending the webinar. I would like to say that one of the common themes that we'll have throughout this discussion is that use your resources or access the resources that you have available to you. And Susan and the Montgomery County Medical Society staff and the State Medical Society are great resources. And a lot of the decisions I've made has come within consultation. They have plenty of programs, as even Susan just mentioned. So use your resources. So as Susan said, I am Brent Faulkner. This is Joanne Faulkner. She was very instrumental in my decision and throughout my practice journey. And without her, none of this would have been possible. This is, as you'll see, this creates a lot of uncertainty, and that we have traveled through this journey together. For sure. Quickly, just to kind of go over what we'll discuss, I'll talk about my background, what decision trees I've had to come to in several different aspects of my career, my approach and implementation when I made certain decisions. Again, the rewards and challenges that availed itself to me at the time, and then we'll end with recommendations, answer questions, and if you have questions throughout the talk, feel free to place it in the chat, and we'll try and get to them either through the discussion or at the conclusion. A little bit about myself. I am as Susan mentioned, I'm a private practice plastic surgeon. I finished my medical schooling in 1999 in Richmond, Virginia, I did a 6-year plastic surgery residency that I completed in 2005 at University of Virginia. And at that point, I had options, post-residency options as far as employment, as far as how you're going to set up a practice. Are you going to join a university setting? Are you going to be in an employed surgeon? Or are you going to go at it alone? And one thing that we know from, or at least that I learned in medical school and residency, as probably most have, is that I felt well prepared for taking care of patients. I know, feel 100% confident in that as best I could at that time. And obviously that you have a progression as you age in your career with experience and so forth, but I felt very comfortable in taking care of patients, and I felt your training prepares you for that. What it does not prepare you for is the business side of medicine. I cannot think of many discussions, seminars, so forth. Times may have changed by now, but at the time there's very little about that. So my post-residency options I felt were limited. Did some people go at it alone and open up their own solo practice following residency? Sure. But for me, I did not have the confidence or the business acumen to feel that would likely be successful. So at the time, I felt the best option. I did not see myself in a university setting for whatever reason. And so I looked at joining another plastic surgeon in an employed setting. So essentially, for the first part of my plastic surgery career, I was an employed physician. And at the time, that was the best decision for me. It allowed me to progress in how I was going to practice plastic surgery. I was with another plastic surgeon that had been in practice for 15 so years. And I used him to kind of see some of his experiences, see what I liked and may have chosen for me that I felt was beneficial. So there was a lot of benefit in the early going, not only from a financial stability, but a way to kind of grow in the actual early career of plastic surgery. So in the short term or the early term, that was beneficial to me, and especially with the downturn, I believe it was in 2008, when there was a large economic downturn. I still had that stability, and I still had the financial stability at that time that allowed me to continue practice in my current setting. So in the beginning, that was a good option, but then I found over the years that my practice didn't progress the way I wanted it to. I essentially felt like I hit a plateau. My thought was to possibly buy into his practice at some point, but for whatever reason, that did not financially, so forth, did not present itself in a way that looked good for myself. So at that point, I had to consider, to make a change. And that's why I was considering that at that time. So again, I had a decision tree. The options at that time were very similar to the options during completion of the plastic surgery residency. One option would be continue with the status quo. Well, again, I didn't feel I was progressing in my plastic surgery practice. I had a strong reconstructive component of my practice, but I wanted to grow the aesthetic side. So my vision for the future and the physician I was working with or employed by did not align. So I actually at the time looked at other employed models, whether you look at joining a private hospital that may hire you, may not be an option in this geographic area, but I know of other plastic surgeons that have done that, whether you join a multi-specialty group, look at some other type of employed position. I also actually looked at, in another geographic area, joining another plastic surgeon that was close to retiring and considering buying into his practice. But again, I felt that was very similar to my current situation. And so I did not feel that was a good choice for me at the time. So that's when I started to explore, or we started to explore our own practice. So again, this is making a leap, and at the time, it's a scary proposition. I like, in general, I like not a lot of change. And so this is a big change for us, for our family. It's you consider it a risk. And so we started to explore this. So what are the factors that you need to consider prior to a change? And the first thing you have to consider is your separation from your current situation. If you just all of a sudden stop working with your current employer and just say, now I'm going to open up a practice, it's going to be 6-9 months before you can probably get fully up to speed and actually start seeing patients. So you have to look at whether you have a contract with your former employer, whether it's with a hospital setting, what your current situation is, what your non-compete clause, and again, using your resources that might be available, whether it's representation legally, advice from an attorney that can kind of look at your contract and give you ideas or give you guidance as far as that. I had a 5-mile non-compete clause. So again, that limited me possibly to where I could practice. I was fortunate enough that it didn't prevent me from the hospitals that were within that 5-mile radius, but I just couldn't open up a practice in that. So we started to look at locations. And again, as I've mentioned, using your resources, we had a commercial realtor who was very instrumental in helping us locate where we might be. She was very experienced, I think over 20 years. She knew Montgomery County very well. She had office space available that we could look at. She discussed us about, whether you want to lease something or buy something. And for us, we considered both. And again, Joanne was with me throughout this entire process, helping to kind of look at it from a different angle as well. And so for our particular situation, and especially with the non-compete clause, it had about an 18-month termination date. So we felt that if we bought and we might be tied to an area that we might not otherwise want to continue practicing. So that's why we considered leasing. The next thing you have to consider, again, this is all before you actually open your doors, is what services are you going to offer? In plastic surgery, through my practice, I had an idea of what type of patients I want to see, and whether it was insurance, whether it was fee for service. And so I kind of had an idea of how I wanted to start my own practice. And again, you have to consider carefully your insurance participation, fee for service, or a combination. For me, I valued the insurance aspect in primarily in dealing with skin cancer, dealing with breast reconstruction, is that's generally going to be an insurance-based practice. I wanted to have a strong influence in that area, but also, again, as I had said, I wanted to grow my aesthetic side, which is typically fee for service. So I was looking at a combination of the two. But your particular field, you need to make that decision. And nowadays, just about any field can carve out a fee for service aspect of your business. Whether you want to do that or not is a different story. But sometimes that can be, in a sense, less burdensome administratively and provide financial growth that you might not otherwise have access to. And just as a side note, I know of an emergency room physician. He stopped becoming an emergency room physician, so he actually changed fields in a sense and opened up a fully aesthetic service, a Medi-Spa, that had lasers, cool sculpting machines. He did Botox, he did fillers, options that people have. Other fields can have nurse practitioners, can have nurse injectors. So there's a way to kind of carve out your fee for service, and medical device companies are always exploring that. And I will go to seminars from companies, and they are, they're part of their outreach is to not necessarily to plastic surgeons or other types of surgeons, but to a general physician population. Also, another factor that you need to think, are you purely going to go at it alone? And that's what we decided. Are you going to have multiple practitioners in your office? Are you going to have a nurse practitioner? Again, in the early setting, we had felt that just going at it alone is how we'd start. That's going to be a leaner way to start. And then as we've progressed, our model has changed to some degree where we're looking to add more of professional group nursing and so forth in order, again, to kind of grow that aesthetic side. So now that as we're starting to make that leap, we've already decided that's what we want to do. We haven't convinced ourselves that that's going to happen, and I'll get to that in a second. And so now we got to look at the approach and then kind of our final implementation before we actually open the doors. A critical piece is developing a business plan, and quite frankly, when I looked at this initially, and Joanne and I, we had no idea what a business plan would be. So we would look on the internet, a typical medical business plan. But we also had I knew another plastic surgeon that had was in a similar situation as me, and he had again made a decision to go on his own. He had worked under another plastic surgeon as well, and so he was a resource that was instrumental in providing us with kind of some tidbits and pearls, not unlike what I'm trying to share tonight. So in a sense, I guess, passing it along, you could consider is part of my goal this evening. But a business plan is important. And again, what is a business plan? It's looking at how are you going to set up your practice? How are you going to analyze or predict your revenue, your estimate your cost? How are you, if you do have financing that you're looking at, how are you going to pay that back? How are you going to grow your practice? How are you going to get new patients? So business plan is kind of your framework for how that you then progress in your practice. Secondly, you got to look at the financial starting of the practice. Now, there might be some that have the financial means that they don't need outside funding. We were not in that position. So we had to look at, how are we going to come up with the correct amount of startup cost, and what is that cost going to be? And so we spent a long time looking at our options for that. Initially, we looked at large banks, whether it be Bank of America and so forth, and they really had no interest in us. In small business startup, we looked at private funding, but felt that was likely more predatory. And then at one point, we didn't know if we were going to be able to secure funding. And of course, that can change your options and what your ability to do. But and we finally located a small bank, the NIH Federal Credit Union, and they actually had a small branch that their whole focus was on small business startup. And so in working through them, and they helped us a bit with the business plan, but in working through them, I do remember one discussion we had, and this representative had said, listen, you're at the end of the day, you're still a physician. And so, yeah, we are taking a risk with you, providing you a loan, but you still have, even if the business does not work out, you still have earning potential. So you're still a physician. It's not like opening up a restaurant and the restaurant fails. What are you going to do then? Well, if a physician practice fails, well, you do have other options. You can go back to an employed situation and so forth. So they were willing to take a gamble with us, but that process took a while, and our whole process 3 to 5 months in trying to secure funding. And again, all these steps are before we even open the doors. So you got to look at planning that you have to have a good 6 months, 9 months before you can actually open the doors. Next, the next two aspects, credentialing, that I'm going to have Joanne speak to, and MPI and tax ID for business setup. This is Joanne. She's going to give us a few words.
All right. Well, my theme of the night is that you can DIY all of this, but at the end of the day, hiring someone who does it in their sleep is generally the way to go. And with credentialing, that's exactly what happened. Yes, it's easy to do. There are a million steps. I was completely surprised that even though Dr. Faulkner was totally credentialed with all of these insurance providers, we had to start completely over, which was unfortunate, but it was a very long process. You need 6 to 9 months, because I don't know, it just takes forever. And we eventually did hire somebody who did the credentialing, and it was once we did that, it was wonderful. There are different levels of people you can hire. We hired someone who just got it across the finish line, but you can also hire somebody for more, who will actually negotiate your contract with the insurance companies. And I am now at the point where I'm suggesting to Dr. Faulkner that maybe we go back through and redo that, because I think we were going in a little bit blind, and I don't know that we got the best contracts the first go around. So something to just think about. With what I learned on the NPI side of it was that it made sense to have an NPI for your organization. So we did do that. And the reason is, if you do hire somebody eventually, another practitioner, a nurse practitioner, somebody to work under your umbrella, it's good that you're all using the same NPI, the same organizational NPI. Tax ID is self-explanatory. Just get that through Maryland. So.
And again, as Joanne mentioned, as we said, this does take time. And the credentialing, even the person that we had hired, and I don't know if it's different. It seemed to be, he was surprised at how cumbersome, and even he had experience with this, but he was in another geographic area. He was surprised at how much it took and how many different insurance packages that there were. There's Care First, there's Care First Medicaid, there's United Healthcare, there's, United Healthcare Medicare, there's, Priority Partner, we're still finding new packages. And it's even now we are not fully credentialed with everybody that we had wanted to be. But I'll tell you is that one thing we did find out is that there were certain insurance companies that I had been with, who said, you know what, we don't, our roles aren't open anymore. Even though I had just ended my relationship with them from the previous tax ID or the previous employer, now I was no longer needed. So it was mind-boggling. This was some of the Medicaid programs as well. As we mentioned before, having an accountant that you can rely on, and an attorney for legal advice, and the attorney was more instrumental in the beginning stages. Like I said, I got a lot of advice regarding the separation with my previous employer. The accountant is more for, when you start to practice, and that your kind of your revenue stream, your costs, your predicting your for the next year, your tax structure. So again, talking to someone within your field, talking to the medical society can give you referrals for people that might be able to help you with that, because that's very critical and important. Again, I'm going to have Joanne talk to you about the website development, which we think is another critical piece for any practice.
So when Dr. Faulkner was getting all of his advice from practitioners, there was a theme that you should really invest in a website, and which is what we did. We found a provider who doesn't offer services to anyone in this area. So they're based in California. And as far as I know, we're the only plastic surgery office in this area that they work with, and which is great. You should find a provider, a website provider who does that for you. And we got their best package, and I will always say this is one of our best investments, because when we are grinding it out, we don't have to worry that something's going to happen with the website. And it has been really wonderful. They also do all the marketing for us. They do they help with the content. If I have a quick change, they are on it. I mean, it's so worth it to have somebody. Again, yes, you could DIY it, but this is just one of those areas where investing makes all the difference.
And a little bit further in the website, again, it is important for your branding. And I wouldn't call myself a self-promoter. And so it's nice to have a website that can, in a sense, do what I'm necessarily not that comfortable with, or that Joanne can help me with. And also it's good to look at whatever field you're in, to look at, and maybe not necessarily field specific, but what you're trying to set up, look at the best practices within that organization or in your vision. And you can kind of model, you can kind of see what website designs are on the high end, which are maybe not quality wise, maybe more so on the low end, and kind of see where you may fit with that. Not every practice needs to have the same kind of capability or the same input as far as the website's concerned. Of course, electronic medical records are a big part of the initial practice. How are you going to deal with records that's no longer going to be a written record in a sense. And so we spent time on this. And again, you may look at your specialty or your practice of medicine, particular field, what some of your peers might be using. What we decided is, because we're going to have a large, or 50% insurance side, we needed a more robust system to handle the insurance claims, insurance correspondence, our day-to-day, our practice management, our billing. And so it looks a little bit different when you have an insurance side versus if you're purely aesthetic side. Next, not necessarily a small part, but something that you have to think about, medical supplies. And again, we used a representative from Henry Schein, who's a large medical supply company. And she was able to, she probably had over 20 years of experience. She knew all sorts of practices. She had been working with, a pediatric practice, another plastic surgery practice, a dermatology practice. So she could kind of help us. I knew kind of what medical supplies I needed, but I didn't know kind of all the day-to-day stuff that you might need. And she was very instrumental in that. Again, you got to look at an initial employees. I was fortunate enough that that the medical assistant that had been working with me at the previous practice came with me, and so we had one medical assistant and Joanne and myself. So it was three of us when the doors opened. But you have to look at how are you going to start your initial practice. And again, another central theme is, I think, is start as lean as you can, and you can always build from that. Now, in starting lean, It puts more work on the ones that are there for sure. But it also, from a financial standpoint, keeps costs as low as you can. And then again, looking at payroll, how to set that up, the accountant kind of helps you, or at least helped us with that with QuickBooks. And then as you kind of progress, you may look at more robust services, which, again, whenever you look at something that's more robust, that means it's going to cost more. But as you progress, you'll find that it's very beneficial and sometimes more efficient to do that. So what happened? So we finally had made the decision. We finally decided to separate. We went through all these steps. And so we opened practice in February of 2019. As I mentioned, we had one employee and then the two of us. We did a combination of fee for service initially. We still do aesthetics. And then we have an insurance-based part. We did survive COVID. And not only did we survive COVID, but during the COVID months early on, we were able to not only keep the doors open, we did not lay off any employees. Now, I will tell you again, the resources, the Montgomery County Medical Society, the State Medical Society, it was very instrumental, very helpful when it came to programs to help small businesses, to help all practitioners to survive COVID as well. So we definitely took advantage of that. Since that time, we've had growth every year. Like I said, we started with one full-time employee and two owners, and now we have 6 employees and the same 2 owners, fortunately. And of the 6 employees, 4 are part-time and 2 are full-time. So we had expectations. So what was the reality? Well, we knew it was going to be a lot of work. I don't think we knew how much work. It's definitely more work than we anticipated, and it requires dedication. Again, you're independent, and that is very powerful and is very beneficial, but it does come with consequences. And so if something doesn't get done, it's your responsibility. So, and there's lots of things to get done in a practice. Managing an office staff, and whether it's office staff that are your medical assistants, your front desk, this takes a lot of energy and effort, and it's very difficult. I think this is, out of everything that I do, compared to this is, surgery is easy compared to managing an office staff. And this is, again, something that I had no preparation for from medical school or from residency. I did have it in a limited amount with my previous employer, because I was essentially responsible for hiring a medical assistant, but this is hiring your entire staff. And not only hiring the staff is, how do you manage that staff? And we made a lot of missteps, I think, in the beginning in leading our office. And so we've learned, but that continues to be. I mean, we could probably talk for hours on stories about, our interactions with staff that are mind-boggling. I mean, we had one nurse that ghosted us, just didn't show after she had said she needed time off, and she just didn't come back and wouldn't answer calls and never came back. And I actually went through and trying to contact her. We had a note from a physician that had given her a medical excuse at one point. And I asked, we just want to make sure that she was safe. And so he did confirm that. And he said he let her know that we had asked about her, but we never heard from her. So you're going to have lots to deal with that you never expected. I'm going to have Joanne speak more about expectations versus reality on marketing.
All right, so I will say the very, very best marketing is Dr. Faulkner. Patients, if we can get them in, they want to hear what he has to say. What does he suggest? What does he think that they should they should do. And so the key then is to get them through the door. And that is so much harder than I realized it would be. First of all, you have a lot of really creepy people who are trying to sell you leads. And I admit I did fall for it pretty early on. It's, it's one of those too good to be true things where they're gonna, if you pay this X amount of money, which was actually a really large amount of money, I feel bad, you get like crazy amounts of leads, and it ended up being such a bad investment. It's slow and steady wins the race. You have to one foot in front of the other. I talked about my website people. They are fantastic. They do all of our ads that run, and they are the experts. They're analyzing it. They have the expertise to do it. I will put stuff on social, but I'm just not even in their arena. These are people who do it full time. So we also hired somebody who knows social media, who understands hashtags, who is comfortable in that space. And those ads are more successly when you have somebody who's doing it, who really knows what they're doing. I'll occasionally put something on and I'll boost it, and it may or may not. Marketing is a juggernaut. If you buy new technology, there are all kinds of promises of how the company is going to do all these things for you. They're going to have parties with, all kinds of success. And it just, at the end of the day, it's hard work. It's, one ad after the next. And really, it's building your patient base. It's building relationships with your patients. And it's having those conversations that about the services that really end up, I think that's how we get people to continue to come back and try our new technology. Yep. Oh, back over to you.
And then the last two are basically the same. Dealing with insurance companies and administrative burdens are fairly united. And I dealt with insurance companies before, but when you're dealing with this from a private practice standpoint, it is a monster that you try to tackle and you have no success. I have very limited success. And you have to go through pre-authorization to say that you can do something. Well, that is meaningless unless you don't get it. Because if you don't get it, they definitely don't pay you. But you get the pre-authorization for, let's say, a surgery, and then they ask for all the same information that they asked for in the pre-authorization to then tell you that they need more information. So they deny you on payment, and then they ask for more information. They don't tell you, and I dealt with this actually today, they don't send you information that they've done this, and then they say, but you only have 45 days. So they wear you down. And I think that's on purpose because it does work, because they do wear you down. So we can talk a full hour on insurance companies and even more. So again, after hearing all this, you'd be, well, why would you ever open your own practice? And there are rewards, and the rewards far outweigh the challenges. Or the rewards that you get make all the challenges and all the dedication and hard work, it does pay off. There are financial gains that, like I said, we have progressed every year. We have independence. And so we're responsible for our growth. We're not relying on someone else. We're not restricted in our vision. We're only restricted by our own vision that we make. You watch something that you've created, that we've created, and you watch that growth. And so you take pride that you're providing quality care. And I feel confident that I can provide quality care to patients, singularly. But if I don't have a strong staff around me, whether it's Joanne, whether it's the front desk, whether it's my medical assistants, it doesn't matter how good you are. Your entire team has to be committed to your vision, so that you provide the best quality care. And I think that we've realized that you really do need a quality team. And if you have someone that's not part of that quality, then you need to make a change. And So again, some of the challenges were, the hirings can be very difficult. It's to kind of go through the magnitude numbers for a medical assistant is a lot. And we did go through Indeed, I believe, possibly, or we went through a hiring agency, and that did not work well. But also the challenges and terminations. And if someone doesn't fit your quality team, then you do have to make a change. We've mentioned about insurance and claims and collections. And then finally, there's seemingly no rest. Like I could be doing something right now for the business. There's always, it feels like there's always something to do. So there definitely, and then challenges will continue to come. So what's a vision for the future that you need? Well, first of all, you learn from experience. You learn probably the most from your missteps, and you learn from others. Whether it's the medical society, whether it's other plastic surgeons, whether it's with people that refer patients to you, you can learn from them. You learn how best to set up your practice and progress. You have to be able to adapt with the changing medical climate, and the medical society is great for helping you through that. And medical practice today is a lot different than it was 30 years ago. And in 30 years from now, we're probably going to be saying the same thing. You have to plan for growth or maintain. And then not only are you looking at a 1 to 2 year vision, you have to have a 10-year vision as well. So let's get back. Did we make the right decision? And I can emphatically say yes. Now, what I will tell you is that first weekend in February in 2019, and I think Joanne remembers this, is that I was like not so sure. I don't know what we've done, because I just feel like I am drowning in about 50 feet of water, and I'm on at foot 1. But it was the right decision. It's your creation. Life is better now than it was 4 years ago. Just a recap: a private practice, small business, your own practice, it can be very rewarding, but it's a journey. It's got ups and downs. Plan as best you can. Like I said, main theme, look at your resources, look at your peers who've had similar transitions, whether it be with the Montgomery County, MedChi. Final words: don't be afraid to challenge yourself. It was well worth it, and I would do it all over again, but possibly sooner. So that's about all we had, and we're definitely open for any questions or comments.
Thank you so much to both of you for sharing that really interesting journey. I'm glad that you feel really confident in the decision at this point anyway. So I put a question in chat.
Sure.
I was curious, it's 3 questions actually. It's how much notice did you have to give to your previous employer before
Right.
you were able to leave? So how long did he know that something was afoot?
And it was, our contract said 60 days. Said there was in our contract, either one of us, he could say, you know what, and it may have been actually, I take it back, it was 90 days. Said, it may, through either one of us, no fault, we can say this isn't working out and we're done. So it was a 90 days.
Okay.
So I gave him 90 days.
You gave him 90 days, but you had obviously been planning this for
Sure.
quite a long time.
Correct.
Before that. So you're doing this at night, you're on the weekend, you're trying to evaluate all these different things you've shared. And so I'm curious, once you left him though, was there a period of time before you actually opened your doors that you were still trying to plan and put things in place?
He asked if I could stay 1 more month. So the plan was to start January of 2019. He just asked for the transition, if I could stay, if we could delay opening 1 more month. And so we did, but I basically did surgery, I believe I think we opened on Thursday. I think I did surgery on Tuesday or Wednesday. And so I had follow-ups from the practice.
Interesting. So a question about that, usually with those non-compete clauses, there's also some clauses about not being able to market or
Sure,
to tell your patient base that you are going elsewhere.
correct.
So what percentage of your prior patients, if you will, have now found you, are coming back?
Now,
How was that handled?
a lot of the insurance. So anybody that I had recently done, and in full disclosure, I talked with the previous plastic surgeon, and we came up with something that was reasonable. I wasn't gonna, try and induce patients to leave. But if it's someone that I've done breast reconstruction on, he understood and he supported that we need to tell them to. So from that standpoint, but there wasn't a lot of. I mean, the folks that I've done surgery on, a lot of that it did come back because they would call up and say, "Oh, I need to set up an appointment with, Dr. Faulkner," and they say, "Oh, well, he's no longer with us," and they would tell them my address. But I will tell you that there have been practices because I knew someone that that they had referred a patient to me, and I was trying to contact them to give them an update, and they said, "No, she's no longer with this practice." "Oh, can you tell me where she?" "No, we don't know. We can't tell you." so, so everybody's different, and so if you can work it out with your previous employer, and so I felt that we left on good terms, in a sense that that we could. I wasn't going to do anything to try and quote unquote steal patients from them or anything, and he was reasonable to be like, yeah, if you did some critical procedure on somebody, it's reasonable for them to follow with you.
Well, it's very helpful that you both put patients first
Right,
and
yeah, no, I think
not your own personal gain or loss. So that's really wonderful. You had touched on this a bit, but my last question was, how long did it take you to realize you'd made the right decision? It wasn't that first weekend,
no,
but
it wasn't the first. It was pretty short afterwards because it's pretty powerful. We had some financial, by having that loan, securing the financing. So we had kind of a window. It wasn't long before COVID, but we had kind of a window where we had some cushion. It wasn't like if we didn't see 30 patients next week, we're going to be in trouble. So I think it was within the first maybe couple of weeks, even months, because when you start to, because we still like, I have referrals from, great dermatologists, from great, primary care physicians. And so it started to kind of progress in that sense. So, and then you really start to feel the pride in that, and this is our creation. And so they're coming to see you, not because they couldn't see necessarily someone else. So it is very rewarding in a selfish standpoint too.
well, we do have a question for one of our participants. Would you still consider starting a private practice if you didn't have a cash only aesthetics portion to your practice?
You mean if I didn't have it at all?
If you were 100% insurance or some level of self-pay, but not as considerable amount of self-pay.
Yeah, no, I would. I would still consider it. Because it's rewarding, and not just, aesthetics kind of help the flow, but we've grown in our costs. You can have cost containment so that you don't necessarily have to have a 50% aesthetic business in order to survive. So even if I did 80%, 90% reconstructive, now it would be more difficult, there's no question, and that's because of the insurance companies, quite frankly. But I would still do it because I think that if you were in my position, if you felt like that you were stagnant in your current level, now if you had great fulfillment, in what you were doing, and you didn't see, what I saw, that I wanted to kind of expand. I wanted to progress. I had a different vision. And so even my reconstructive side has progressed since leaving. So it can all do that, but it's not, it's still the same thought process.
Well, again, it's just been fascinating to hear about your experience. We do have another follow-up question. Would you consider starting a private practice with the tight labor market and worker shortage in 2023? Everyone seems to be struggling in finding and retaining staff. So do you have any pearls about how you've been able to increase your staff?
Yeah, I mean, a lot of our staff, we do have, I think, 2 staff that are greater than a year. But 2 of our staff are within the last 3 months, 5 months. So, but what we found is that the cost is higher. We found it, and you have to be competitive in what you offer. We couldn't offer, 401k. We can't, full medical, benefits initially, and we still don't offer full medical benefits, but we do now, and I think you actually have to anyway, offer a 401k. But we've started to kind of realize that sometimes you have to be more competitive for quality folks. So even if we lost, and we have to be prepared, because this has happened to us. We had 2 of our full-time, 1.5 employees quit on the same day. So you have to be prepared. It was Joanne, for one day, it was Joanne and I answering the phone, seeing, he's seeing pain. So you have to be prepared for everything. This was a little earlier on. So we would have to be, even if everyone quit tomorrow, we would have to figure out what to do. And one thing we found is that you have to pay a little more.
So how are you doing your call coverage? I mean, are you doing that all night, every day? Or do you have some colleagues?
I've done this from day one, is that I have my cell phone at all times. And so I give my cell phone number out to all my patients, especially if I do, any type of surgery, so that I want them to actually call me, even if I'm wherever. Because I'm committed to them. I consider them part of my family. And so, I don't, if I'm going out of town, I'll have, and I still have a relationship with my previous employer. He will still cover me. I will cover him. If he goes out of town, then I'm available to answer. Same thing, but I still want to be the one. So I'm on call all the time, but I don't, it's not like I'm getting calls. Now, maybe if you're a pediatric practice and had, a lot, I don't know that you could necessarily do that, but I'm on, 24/7, but it's not, it's very, once I stopped taking hospital call, life changed for the better.
Good. It appears that Dr. Santi may have questions. He's a neurosurgeon and relies a lot on the hospital. So Dr. Santi?
Hi, thank you. That's an
Yeah.
excellent presentation. I just
Yeah.
wish I heard this like 5 years ago.
Yeah.
So, I'm a neurosurgeon. Mostly I was working as an employee physician before, and I want to do research. But my main question right now, I have like 1,000 questions for you, but I'm
Sure.
just going to ask one question. As a neurosurgeon, we have to do a lot of calls. And if
Right.
you're in private practice, what is that the hospital expects from you? Like, do you have to cover calls for them, or do you have to, do they expect a certain income, like you have to give them from your surgeries? What is that a hospital will allow you? Like, what is that hospital would want from me if I want to open a practice in a market or a town?
Well, and let me see if I understand your question. So that you mean would the hospital make you take calls, so that if someone comes into the emergency room that you would be obligated to see them? Is that what you're?
Yeah, yeah, because like the other private practice neurosurgeons in the town that I'm interested in, but I can provide a lot of neurosurgery coverage from the brain or spine and both. So why would any hospital in that town would be interested? Like if I want to work there, like
Well, I can't speak for the particular hospital, but let's say I go to Shady Grove, and at
Uh-huh.
one point there was an actual hospital call. So you would sign up if you wanted to, but you
Yeah.
didn't have to. And
Got it.
so it wasn't it but if your neurosurgery department, at one point they tried to make it mandatory that people that were on staff
Mhm.
or that had privileges have to take call. But that's no longer been the case. So what Shady Grove had converted to was you could elect to be on a call list, and they would just call you, and if you're available, you come in. So from a neurosurgery standpoint, I don't know if part of your having privileges at a hospital, would they require you? That's something that you would have to find out to see if I feel like I'm addressing what you're asking.
Yes, yes, I think you answered. Yes, thank you. I appreciate it.
But
And
I don't, like, if I do surgery, I'm not employed by the hospital. So if I do surgery at Shady Grove, I have my own surgical charge,
Mhm.
and then the hospital has their own charge, and they're not connected in that way. So it's not like they get a cut of what, they get their own fee that is pretty large.
Yeah, yeah. I mean, like there are like 100 primary care doctors for like one hospital, another hospital has 60 primary care doctors. So if I do surgeries there, and if I have my own practice, I think the hospital itself will benefit from me doing the surgeries there, especially spine surgeries or so. So
Sure, and that's an important discussion to have with the hospital and say,
Mhm.
hey, listen, I'm willing to provide, a certain amount of call, maybe
Mhm.
not, 24/7, 7 days a week, or not,
Mhm.
whatever you want to set up. But I'm willing to have my, it's powerful as a surgeon to be able to say, I can provide you with, maybe a certain amount of volume.
Mhm.
And it can be kind of a win-win for both.
Got it. Great. Thank you so much. I
Oh,
appreciate
you're
it.
welcome.
So Dr. Faulkner, are you doing any procedures in your office, or
Yeah.
do you also use a surgery center and a hospital?
Yes, so I use it all. So for insurance base, generally, it's going to be at I mainly go to Shady Grove and Suburban Hospital for whether it's breast reconstruction, whether it's breast reduction, anything that we typically get approved through insurance, typically is done at the hospital. Now, in the state of Maryland, you can't do aesthetic surgery in the hospitals, and it's not that you can't do aesthetics, is that the hospital can't give you what they did in the past is they gave you a discounted rate if you did your surgery there. So if you look at the rate that a surgery center charges an aesthetic patient versus what the hospital gets from an insured patient, they are, I mean, magnitudes different. So the state of Maryland said a hospital can't offer a discounted rate for aesthetic service. So in Maryland, we actually have to do our cosmetic cases in a surgery center or in your own office setting. But I do, if it's, I do some surgery in the office, whether it's, something I can do under local. I don't do sedation, but but I can do a lot kind of under local. But things that require general anesthesia or sedation, I would do at a surgery center from an aesthetic standpoint.
All right, so we have two questions, and we recognize that the hour is getting late, but we want to make sure that we ask these. When you were starting out, do you pay yourself and staff out of the small business loan? Did you find ways to supplement while your practice was ramping up? And how long did it take to get a full schedule of patients?
So let me start with, so we did pay our salaries, and I took a salary as well. We did at the beginning from our loan. So that was, we had maybe 3 to 4 months of operating costs. And so paying employees is part of that. The second question,
Full schedule.
oh, when did we have a full schedule? I mean, we still don't necessarily have a full schedule every day, but I would say within about, what would you say, maybe 4 to 6 months? 4 to 6 months, we had a reasonable schedule that could support what we were doing.
Probably nice to have a chance to catch your breath a little bit.
Yeah, no,
Uh,
well, because it's actually beneficial to not be as busy in the beginning, because you've got so much else to do.
Yes.
And you're working out how to do things. Like I would call insurance companies and try to figure out how to do a pre-authorization. I'd never done that before. So a lot of it. So I've done, and Joanne has done, except for the surgery part, has probably done every part of our practice. I've answered the phones, taken out the trash, done everything from kind of A to Z.
That's great. Well, and
Maybe
we're
I
going to
should
end
do
on
more at home too, I guess.
we're gonna take this last question. Were there some insurance companies you chose not to participate with due to more difficulty with the reimbursement?
Well, I can tell you that we tried to sign up with everybody. We really did, from A to Z. And we had some insurance companies say, no, we don't want you. But we tried to sign up with everybody. Now, if you ask me now, after 4 years, who I would not, there are some insurance companies. Aetna, I would not sign up for. I mean, just today, I was dealing with, I had done procedures on a patient, and they have still neglected to pay, and for no good reason. And so Aetna has been very difficult. And there's a couple others that, and I have to say that some of the Medicaid insurance companies have been surprisingly very, and I guess I shouldn't be surprised. I mean, they're still, but have been very good and have been very responsive. I found that the United Healthcare, the Aetnas have been very difficult. Not as much with Cigna and maybe surprisingly to some, but Blue Cross Blue Shield has been kind of they give us the least headache.
So it sounds like, though, from Joanne's advice, that you're about to try to renegotiate some of those contracts. So
Yeah.
we will just see how that goes.
Right.
Maybe we ought to have a part 2 in about another year or 2 of
Right.
this presentation. But, I'll be curious how things go with you being a solo, and private practice plastic surgeon, and whether or not, now that you have a track record, whether you can negotiate better rates
Yeah.
because of that.
Probably not, but we'll see.
We can end on that positive note,
Right.
right? Yes, we need part 2 next week. Somebody else agrees. Well, thank you both. This has just been amazing. I appreciate the Medical Society being able to ask you to do this and to share your passion with others. I'm glad this is being recorded so that we can put this on our YouTube channel and share it with others. I know you did not put your contact. Oh, there is your
we go. I
contact
did.
information.
Yeah, I forgot.
So
Yes.
everybody can contact you and get you to
Yeah, and
share more of those pearls.
And like I said, I'm available. It is very helpful, and it gives you a lot of comfort to have people that you can talk to, whether it's Susan, whether it's MedKai, whether it's another plastic surgeon or someone else in your field, or someone that it's very comforting to know that. I mean, a lot of people have been through this, and so there's a lot of advice out there. And it's helpful. Now, you may not choose to do exactly how someone else does it, but it gives you something, a frame, kind of a framework to work on.
Well, and not everyone has had your challenges of trying to get through a pandemic as well.
Yeah.
So, congratulations though to both of you. I think it's just important to show physicians that there are options. And usually what they hear is that private practice is not an option anymore. And so the more we can do to encourage them to consider this, whatever is right for them, is the best way to go. So thank you again, both of you. It's great. We appreciate your leadership, Dr. Faulkner, and the Medical Society. Dr. Faulkner continues to be on our board and providing this kind of valuable input to us. So thank you both. And on this note, we will end our webinar and look forward to seeing you next time. Thank you so much.
Thank you.